What is the role of health professionals as patient advocates?
We've made it our business to learn and understand the system and every way to either access it or to circumvent it that we can. We in turn have then shared that knowledge with our patients and their families and our community. So in essence, the advocacy work is in educating the navigation side of healthcare in the same way that we advocate learning about healthy eating or exercise. We have taken on that you cannot treat or support, at least in maternity care, in a silo. It doesn't work. It is not any use for me to give my patient a prescription for an ultrasound and send her out to get one without understanding which ultrasound offices in town will or won't accept her insurance, will or won't have her come in because, whatever reason. If I don't know that myself as the provider or my staff don't know that, we're doing her a disservice in making that referral in the first place. So we advocate from a perspective of navigation. And the fact that we've had to incorporate that into the way we do our practice speaks to the depth and the need for that to happen. So I could posit that my outcomes are as a result of our abilities, expertise, and knowledge in patient advocacy in regards to navigating the system. That's why when people do these endless studies trying to figure out why women of color or women of low income are having such poor outcomes or prematurity rates are so sky high or infant mortality, they sit looking at physiology. It's not about physiology. It doesn't happen like this in other countries. Why are we so poorly ranked in the maternal mortality and morbidity or infant mortality and morbidity? Because our system is broken. We don't have to do any more research on that. We already know that this is not a problem that belongs to the patient. African American women across all socioeconomic status have these poor outcomes based on the fact that this can happen. This is allowable. This is part of the way we do business around healthcare in America. The institution itself is biased and can remain so unless we decide to change it, unless we call it out, unless we acknowledge what it is. The recent situation with Serena Williams, most people know about this case because she's a celebrity and she has spoken out. But even her celebrity did not save her from a system which allows that Black women don't need to be listened to. That's what's so. That's where reproductive justice plays into having a need to point out where the injustices lie and how they got there, and then to continue with how shall we dismantle that? How shall we improve? How shall we educate and train providers, ancillary staff, risk managers, everybody who's involved in this medical care system? That's what I think is missing. That's what I think we need to do next.